As a heart surgeon with over 30 years of experience treating older adults, I can tell you something few others will. Many times it's not age that's weakening your heart. It's a common pill you take every day without a second thought. Yes, you heard that right. Today I'm going to reveal the 7 most dangerous pills for the hearts of older adults. These are medications taken daily by millions of people for pain, sleep, blood pressure, anxiety, or acid reflux, but they could be silently damaging your heart. And the most alarming part? These effects often don't show up right away. They build up quietly, day by day, week after week. This isn't a theory. I've seen it over and over again in my patients. Older adults who start feeling more tired, get winded going upstairs, or feel strange palpitations, and no one asks if the medication is to blame. But many times, it is. I've had patients end up in the hospital not because of a new illness, but because of side effects from a pill they've been taking for years, sometimes prescribed by a well-meaning doctor, sometimes picked up at the pharmacy thinking it's harmless. But what's safe for a 40-year-old can be devastating for someone who's 70. And the worst part, some of these pills are sold over the counter. You grab them at the store, assuming if they're so easy to get, they must be safe. But an older body doesn't respond the same as a younger one. What didn't hurt you years ago could now be a silent threat to your heart. This video isn't here to scare you. It's here to empower you, to ask questions, to understand, to take better care of yourself and your loved ones. Because with the right information, you can make better decisions. I want you to watch this entire video. Because pill number 1 is the most common, the most prescribed, and also the most dangerous. If you or someone you care about is taking it, you need to know what's really happening inside the body. And now I have an important favor to ask. If you've ever taken any of these pills, or know someone who has, leave a comment below. I want to hear your story. Your comment might open someone else's eyes. You never know how many lives we can touch by simply sharing what we've been through. Like this video if it helped you. Subscribe for more honest medical insights made for people like you. Now get ready. Let's begin with pill number 7. Pill number 7, NSAIDs. These medications include well-known names like ibuprofen, naproxen, and diclofenac. They're used to treat joint pain, arthritis, back pain, or even headaches. Many older adults take them daily, some for years, believing they're harmless, but the reality is very different. NSAIDs may seem like a quick fix for pain, but their impact on the heart can be devastating, especially in people over 60. Why? Because these drugs raise blood pressure, cause fluid retention, and may disturb your body's electrolyte balance. All of this puts extra strain on a heart that may already be aging or weakened. A heart under constant pressure is more likely to fail, develop arrhythmias, or experience other disorders, and symptoms often don't appear right away. At first, it might just be some ankle swelling or a general feeling of fatigue, but over time it can lead to full-blown heart failure. I've seen patients show up at the hospital short of breath, thinking it's just a cold, only to be diagnosed with heart failure, triggered by chronic NSAID use. The most alarming part, no one ever warned them. And if you're already taking medications for blood pressure or heart issues, NSAIDs can interfere with their effectiveness. While one drug is trying to lower your pressure, ibuprofen may be quietly raising it. The result, your heart ends up in a chemical tug-of-war without you even knowing it. NSAIDs can also harm your kidneys, and when your kidneys don't work properly, your body retains more sodium, more fluid, and again, your heart suffers. Let me share a story. One of my patients, a 74-year-old woman, had been taking naproxen every morning for arthritis. Over time, she ended up in the emergency room with fluid overload and early heart failure, all linked to her daily NSAID use. If you need to take an anti-inflammatory for more than 3 consecutive days, talk to your doctor. There are safer alternatives. Your pain is real, but so is your heart. Now let's move on to pill number 6. Pill number 6, thiazolidine. If you're taking medication to manage type 2 diabetes, you might be familiar with names like pioglitazone or rosiglitazone. These pills belong to a group designed to improve insulin sensitivity. Sounds great, right? But here's the serious issue. They can directly put your heart at risk. These drugs have a silent but dangerous side effect: fluid retention. And in older adults, that buildup of fluid can become a threat to the cardiovascular system. Why? Because when the body holds on to fluid, the heart has to work harder to circulate blood. It's like forcing it to exercise non-stop without rest. I've seen patients with perfectly controlled blood sugar who suddenly develop swollen legs, shortness of breath, and constant fatigue. In many cases, the diagnosis is heart failure caused by long-term use of these pills, and the saddest part, no one had ever warned them. Another danger is that these medications can mask the early signs of heart failure. That means you could be in danger and not even know it. The signs are subtle, tiring easily, poor sleep, unexplained weight gain, and if no one spots them early, the damage continues quietly. Let me give you an example. I treated a 76-year-old man whose diabetes numbers looked great on paper, but he complained of fatigue and swelling. Once we reviewed his medications and switched to a newer alternative, his symptoms improved, and so did his quality of life. Many older adults with diabetes already have an elevated risk of cardiovascular disease. Adding a drug that increases fluid pressure in the system multiplies that risk. It's like lighting a match near gasoline. Today, we have diabetes medications that don't cause fluid retention and even help protect the heart, but old habits in prescribing often stick around. Always ask if what you're taking is still right for your age, condition, and risks. Managing blood sugar matters, but not at the cost of weakening your heart. Now let's move on to pill number 5. Pill number 5, sedatives and hypnotics. Getting good sleep is a necessity, especially in older age. But many seniors rely on sleep medications like zolpidem, diazepam, or lorazepam, without realizing the damage they may be causing to their hearts. These drugs, known as sedatives or hypnotics, calm the central nervous system, but they can also quietly weaken the cardiovascular system. The heart needs to adapt constantly throughout the night to changes in breathing, blood pressure, and oxygen levels. Sedatives can interfere with this natural response. By slowing down your heart rate and breathing, they reduce your body's ability to react to issues like sleep apnea or oxygen drops. In other words, your body becomes less able to protect you while you sleep. These medications can cause or worsen sleep apnea, a condition where you stop breathing briefly during sleep. This puts huge stress on the heart. In older adults, especially those with arrhythmias or high blood pressure, the effects can be dangerous. Another risk is drug interaction. Sedatives can interfere with beta blockers or blood pressure medications, creating imbalances that lead to dizziness, falls, or more serious complications. I've seen patients faint or wake up gasping, never realizing their sleeping pill might be to blame. Beyond the physical damage, these drugs affect memory and alertness. Many older patients wake up feeling disconnected, confused, or unsteady. That confusion increases the risk of falls, fractures, and hospitalizations. Let me tell you about a 79-year-old patient who had been taking lorazepam every night. Over time, he became fatigued, forgetful, and had frequent falls. Once we reduced the sedative, his energy and balance returned. There are safer ways to improve sleep, like routine changes, behavioral therapy, or natural supplements. And remember, never stop sedatives suddenly. Always taper under medical supervision. A good night's sleep matters, but it should never come at the cost of your heart, brain, or safety. Now let's move on to pill number 4. Pill number 4, tricyclic antidepressants. For years, medications like amitriptyline or nortriptyline were widely prescribed to treat depression, anxiety, or even chronic pain. While many have now been replaced by more modern options, thousands of older adults still take them daily without realizing they may pose a serious risk to their hearts. These drugs directly affect how your heart regulates its rhythm. They can cause arrhythmias, irregular heartbeats, and even a condition called heart block, where the electrical signals in the heart are interrupted. In seniors whose cardiovascular systems may already be weakened, this can lead to fainting, extreme fatigue, or even cardiac arrest. These medications can also disrupt blood pressure, raising it or lowering it unpredictably. At age 30, a fall from dizziness might hurt. At age 70, it could mean a fracture, surgery, and months of recovery. all because of a pill that might not even be necessary anymore. Another troubling effect is on balance and focus. Many older patients report feeling foggy-headed or unsteady on their feet while taking these drugs. This not only lowers quality of life, it increases the risk of domestic accidents. Here's something few people know. These drugs don't just affect the heart, they also interfere with electrical activity in the brain. That dual effect can cause confusion, sleep issues, and emotional imbalance, potentially worsening the very conditions they're intended to treat. I remember a patient, an 81-year-old woman, who had been on amitriptyline for over a decade. Over the years, she became increasingly tired, started falling frequently, and her memory began to slip. Her family thought it was aging, but after switching to a safer alternative, her alertness and balance improved. That's why regular medication reviews are so important. Medications that once helped can turn harmful, especially in combination with others. Your mind and your heart both deserve modern, respectful care, and you should never feel guilty for asking if there's something better out there for you. Now let's move on to pill number 3. Pill number 3, decongestants. When winter hits or the seasons change, many older adults reach for medications to relieve nasal congestion or sinus pressure. Pills containing pseudoephedrine or phenylephrine are commonly found in pharmacies and sold over the counter. But few people know that these decongestants can seriously impact heart health. These drugs work by constricting blood vessels in the nose to reduce swelling. The problem is they don't just act locally. They narrow blood vessels throughout the body, which raises blood pressure and forces the heart to work harder. In younger people, that effect might be tolerable, but in older adults with a history of hypertension, heart problems, or arrhythmia risk, that extra workload can be too much. I've seen patients experience palpitations, anxiety, insomnia, and even hypertensive crises after just a few doses. Because these medications are available without a prescription, many assume they're completely safe, but that's not true. Just because something is sold over the counter doesn't mean it's harmless, especially as you age. Your body changes, and what you tolerated at 40 might be dangerous at 70. I remember a 72-year-old patient who came to the emergency room with dangerously high blood pressure and severe palpitations. No one could figure out the cause until we learned he'd taken a common decongestant for a cold. Just 3 pills were enough to destabilize his cardiovascular system. These drugs can also interact with blood pressure medications, canceling their effects or causing dangerous spikes. That leads to nervousness, trembling, or difficulty sleeping. And one sleepless night in a senior can mean confusion, dehydration, or a fall the next day. If you're managing seasonal allergies or a cold, talk to your doctor before using anything with pseudoephedrine or phenylephrine. There are safer options: saline sprays, nasal rinses, and mild antihistamines. Prevention doesn't always mean more pills. Sometimes it means removing something that never should have been there. Now let's move on to pill number 2. Pill number 2, proton pump inhibitors, or PPIs. You've probably heard of drugs like omeprazole, pantoprazole, or esomeprazole. These medications are commonly used to treat acid reflux, heartburn, or ulcers. And while they can be effective in the short term, long-term use may have serious consequences for your heart. Millions of older adults take these drugs daily, assuming they're completely safe. But recent research shows that chronic use can interfere with the absorption of essential nutrients, especially magnesium. Magnesium is crucial for maintaining a healthy heart rhythm. Without enough of it, the risk of arrhythmias, muscle weakness, and fatigue increases significantly. PPIs also disrupt the balance of gut bacteria. By reducing stomach acid, they allow harmful bacteria to grow, contributing to chronic inflammation, one of the hidden drivers behind heart disease. Another hidden risk is the false sense of control they provide. Many people take PPIs for months or even years without ever addressing the root cause of their reflux. Meanwhile, their bodies struggle with poor absorption of calcium, vitamin B12, and other minerals, further straining the cardiovascular system. Let me give you an example. One of my patients, a 75-year-old man, had been taking pantoprazole every morning for years. His reflux was under control, but he started feeling more tired, developed muscle cramps, and began noticing heart palpitations. When we tested his magnesium levels, they were critically low. Stopping the PPI under supervision made a huge difference in his energy and heart health. This is more common than people think. The symptoms caused by long-term PPI use often get mistaken for aging or unrelated issues. Doctors may even prescribe additional medications to treat the side effects without ever identifying the root cause. That's why medication reviews are so important. If you've been on a PPI for more than a few weeks, ask your doctor, is this still necessary? Your stomach shouldn't come at the expense of your heart. Now let's move on to pill number 1. Pill number 1, calcium channel blockers. These medications are commonly prescribed to treat high blood pressure, chest pain, or arrhythmias. Well-known examples include verapamil, diltiazem, and nifedipine. While they can be effective, especially in younger people, they can become risky for older adults if not carefully monitored. Calcium channel blockers relax blood vessels, helping to lower blood pressure, but they can also slow the heart rate more than necessary. For an older person whose heart may already be weakened, this effect can cause extreme fatigue, dizziness, or even fainting. I've seen older patients arrive at the hospital complaining of exhaustion with no clear cause. After reviewing their medications, the culprit was a calcium channel blocker slowing their heart too much. These medications can also cause swelling in the legs and ankles, fluid retention, and shortness of breath. If the person is already on other heart medications, these effects can be amplified. Another issue is the lack of regular review. Many seniors start taking these drugs at age 60 and continue at the same dose into their 70s without any adjustments. But your body changes, and what was appropriate a decade ago might now be too strong. I had a patient 78 years old who had been on verapamil for years. He complained of low energy, swollen legs, and excessive sleepiness. He thought it was aging. But after adjusting the dose and switching medications, his vitality returned. The issue wasn't age, it was the medication. It's also important to understand that calcium channel blockers can interact with other medications like beta blockers, diuretics, or cholesterol drugs. These interactions can lead to dangerously low heart rates or sudden drops in blood pressure. If you're experiencing symptoms like fatigue, lightheadedness, swelling, or a slow pulse, don't dismiss them as normal. Talk to your doctor. Never adjust these medications on your own. Always do it with guidance. Your heart needs balance, not unnecessary break. Now let's move to your action plan. What you can do today to protect your heart and live stronger, longer. Action plan and closing message. If you've made it this far, you've already taken a huge step for your health. Today we talked about 7 common pills, many used daily by millions of older adults, that can silently weaken the heart. I didn't share this to scare you, but to bring you clarity. When you know the risks, you can act responsibly and prevent bigger problems. None of these medications are inherently bad. Each has a medical purpose. The issue arises when they're taken without supervision for years, in bodies that no longer respond the way they used to. A senior isn't just a younger person with gray hair. It's a body with different needs and increased sensitivity to side effects. My advice is simple. Review your medications. Schedule an appointment with your doctor and ask, is this still the best medication for me? Bring this video as a reference. And if you have older loved ones, share it with them. You could be saving a life. Now I have an important request. Share your experience in the comments. Are you taking any of these pills? Have you felt side effects? Did this information help you? Your story might inspire or alert someone else. Also, if this video helped you, give it a thumbs up and subscribe to the channel for more honest medical advice like this. And please, comment below. You never know who you might help by simply speaking up. Every comment adds visibility. Every story adds perspective. Your heart deserves attention, respect, and understanding. Take control. Don't wait until it's too late. Thank you for watching. Wishing you a long, active life with a strong, healthy heart. Until next time.